What happens when food itself becomes a source of fear? In this episode, I'm joined by therapist and executive director Taylor Rae from the Emily program to explore ARFID, Avoidant Restrictive Food Intake Disorder, and its powerful overlap with OCD and anxiety. We unpack how ARFID is so much more than picky eating, why it's often misunderstood or misdiagnosed, and how it can deeply affect both children and adults. Whether you're struggling yourself or supporting someone who is, this conversation brings clarity, insight, and hope. If you're currently navigating OCD or anxiety and would like some support with that, well, I offer a free 30-minute discovery call. To get that, you can head over to my website, robjamescoaching.com. There's a link in the show notes. Hi, Taylor Rae. Welcome to the podcast. It's great to have you on.
Thank you. Thank you for having me.
No, it's great to have you here. So, to start with, could you give us a bit of background, please?
Yes, so I'm Taylor Rae Homesley. I'm the executive director at the Emily program in Atlanta, and I'm a therapist by training.
Fantastic. So you work with something called ARFID, and I think most people listening probably don't know too much about that. Perhaps they know something about people who struggle with eating disorders. Maybe they have an eating disorder themselves. But could you unpack what is actually meant by ARFID, please?
Yes, so ARFID is Avoidant Restrictive Food Intake Disorder, more commonly referred to as ARFID. With the DSM-5, it became an eating disorder. Previously was considered to be a feeding disorder and was exclusively in children. So it's not really a new diagnosis, but really has kind of gained more awareness since the feeding and eating disorders kind of combined and the diagnostic criteria really expanded with introduction of ARFID. And so what it is it's eating that is limited in variety and or volume and can cause serious medical consequences as well as significant challenges in daily life. And the way that we kind of conceptualize ARFID is in three subtypes. One of those being sensory sensitivity. So these are those kids or adults who are super sensitive to taste, texture, smell, the way a food looks. We also have fear of aversive consequences. So these are those kids or adults who are afraid something bad is going to happen if I eat. I'm afraid I'm going to get a stomach ache. I'm afraid I'm going to choke. Afraid I'm going to throw up, that something bad is going to happen if and when I eat. And then the third subtype is lack of interest in eating or food. So these are those kids or adults who can just go long periods of time without eating and aren't really motivated by food. Food doesn't really excite them. And so people who struggle with ARFID can have one or all three of these subtypes that can occur at any given time.
Yeah. Okay. And ARFID is something then that recently has been increasing. Though it seems to be more and more people are being diagnosed with issues related to this. Is that correct?
Yeah, I think with the kind of increased awareness, with again, it becoming the feeding and eating disorders kind of coming together, there's been a lot more awareness about it. And as doctors and mental health providers have become aware, I think they're seeing more and more people who are struggling with this. And I think sometimes you'll hear it kind of referred to as like picky eating, and it is so much more than that. So picky eating, somebody's going to grow out of. Happens very commonly with kids and adolescents, and they grow out of it. Somebody isn't going to grow out of ARFID. That's something very, very different and is so much more than kind of just that picky eating.
Okay, wow. So once somebody develops a disorder with this, it's something that is very unlikely to kind of heal on its own. You actually really do need an intervention, no?
Yes, exactly. Intervention from mental health professional, from medical providers, dietitians, yes.
Okay. So obviously this podcast is primarily focused on OCD and anxiety, or obviously there's a lot of overlap, I think with kind of eating disorders and obsessions, of course. So could you tell us a bit about how ARFID and OCD and anxiety overlap, please?
Yeah. So at the root of ARFID, regardless of the subtype, really what you're looking at is like a fear of the food itself, oftentimes. And so really that is driven by anxiety.
Mm,
As you said, most eating disorders are a disorder of anxiety, have an anxiety component to it. I think with OCD in particular, we see a really common overlap between that fear of aversive consequences and OCD. So for us here, a lot of the patients that we see who have ARFID and also have OCD are often those who are afraid they're going to throw up, afraid they're going to choke, or have that kind of fear component that something bad is going to happen. And so we see that a real common overlap between those two
mm.
disorders.
Yeah. Okay. And so if people are listening and they're aware that they're perhaps struggling with something, or they're not sure if they might be struggling with something, what should they do to start kind of figuring this out?
First and foremost, I would say see a mental health or yes, mental health provider, but also a medical provider who is aware of eating disorders. I think a lot of medical providers don't get a lot of training in eating disorders.
Mm,
But because with eating disorders, there is that medical component, making sure that you're getting enough variety, you're getting enough volume, you're getting those micronutrients that are really, really important. And having that checked out. And then also having a mental health provider who knows about ARFID. There's a lot of mental health providers who treat eating disorders. And because ARFID, again, is not new, but kind of newer to the eating disorder world,
mm.
finding somebody who really knows it and knows what they're doing is really, really important.
Yeah, yeah. Okay. And so for people who are really struggling right now with an eating disorder of one form or another, you know, typically, for example, with OCD and anxiety, you might encourage people to lean into their discomfort in one form or another. Perhaps people might do kind of exposure activities with their fear, but if their fear is food, like what is the main
What do you do?
approach in these situations? Yeah.
Yeah, so especially again with that fear versus consequence, we treat it very similar. So we'll do fear hierarchies with our patients, whether it's like thinking about throwing up or thinking about choking or like looking at videos of somebody who's throwing up. Those are oftentimes things in those exposures and gradual exposures over time, checking in with patients, helping them to develop coping skills to address their anxiety and to help them cope with their anxiety are all really important parts of treatment for ARFID. And those sensory sensitivities, we are also doing a similar kind of exposure type with gradual exposures. And so we might have somebody sitting with a food or putting it to their lips or putting it in their mouth and then spitting it out. I think a big thing with ARFID is really helping our patients find their motivators. And so not just what myself as a mental health provider my goals are, but really what is that person's goals, and trying to work with those motivators to increase their success of overcoming this.
Okay. And what are some kind of signs that somebody, might be struggling with this? Maybe there's some parents who might be listening who are worried about their children, for example. How do you tell the difference,
That's
and
such it's
spot it clearly, that.
Yeah, it's such a great question. And I think especially for like kids and adolescents, it can be hard
Mm,
because they're picky eating is so common with kids and
mm.
adolescents,
Yeah.
that sometimes it's really hard to kind of distinguish, is this just picky eating or is this more than that? And so some of the things we'll say is if their foods that they're eating are like 5 to 10 foods total and they're very, very limited,
Mm,
then we could be looking at something like ARFID. If there's brand loyalty, so I will eat Purdue chicken nuggets, but not Tyson chicken nuggets, or a certain kind of like specific brand, then we could be looking at ARFID. If there's only eating like foods
yeah.
of a specific flavor, so like
Yeah.
we think of like Cheez-Its, Goldfish, potato chips, things like that. Or if somebody has had a choking instance or throwing up or something like that, and then the variety and volume just like limits and
Mm,
they're not eating a lot. We had a patient here one time who had a really bad choking instance, and then by the time got to us was only eating cheese dip without peppers and mashed potatoes with no lumps. And so that was a pretty significant change from what he had been eating. And
Yeah.
so it was pretty clear to his parents in that case that they were dealing with something more than just okay, he's afraid he's going to choke, so he's not eating a lot.
Yeah.
So really kind of those extremes are what can be helpful in looking at to determine if it's really ARFID.
Okay, okay. And is it sometimes to do with control? Maybe people are struggling with a sense of control in their life in one way or another, and food is a way of finding that control if you're feeling a little bit out of control sometimes in your life.
Yeah, we see that more commonly with our kind of classical eating disorders, so our anorexia, bulimia, binge eating sometimes. We see that
Mm.
control aspect. Not to say that it can't exist with ARFID, but really with ARFID, we're kind of looking at more like fear of the food itself,
Mm.
um, and really kind of struggling with that anxiety. But I think control can absolutely have to do with
Yeah.
a lot of it.
And how do you think that people develop this fear of food? Is it because they've associated somehow the food with a fear response? Is there typical things that tend to set this off?
I think it kind of depends on what subtype we're looking at for. I'm going to speak very, very gradually for a second. So
Mm.
for our sensory sensitivities, for a lot of these kids or adults, they may have been failure to thrive as a baby, and this could have really just been something that has really existed their entire life and
Yeah,
something that they've been struggling with. For our fear of aversive consequences, oftentimes we are seeing there was an acute onset. So something happened to trigger it, and then the disorder develops. Oftentimes, these are kids and adults who are just kind of predisposed to being more anxious. And so they were kind of like this perfect storm of, I already have this anxious personality.
yeah,
Then this thing happened, sometimes happened multiple times, and then kind of perfect storm for ARFID to develop. So I think it can kind of develop a couple different ways.
yeah,
But yeah, that's kind of what we see.
yeah. Fantastic. What would you say for people who might be listening, who might be struggling with this? What do you think is the most important thing that people who need to hear who might be struggling with ARFID?
I think the thing that I hear over and over and over again from our patients who come here is I felt like I was the only one. I think because it's not super common and talked about a lot. Sometimes our families or our patients feel like, oh, I thought like I was the only one. I thought that there was something wrong with me.
Mm.
My doctor, my very well-meaning doctor, thought it was just picky eating and told my parents I would just grow out of it. And
Yeah,
then mom or dad will say, like, I felt like it was something more than that, but I'm being told by professionals. And
yeah,
so I think that's the biggest thing for me is that you're not alone and people can get help for this. And there isn't something wrong with you. And so I think that as a therapist, that's something that I really appreciate that our kids and our adults like get to experience when they're here is like, oh, there's somebody else who's
yeah.
struggling with this too. And then they get to relate on that level. And so I think for me, that's something that I really, really want to impose on people.
Absolutely. Yeah. I think that's really important to realize that you're not alone. And actually, this is a recognized thing, no, that other people have struggled with it too.
Yes. Yeah,
Mm.
exactly.
Absolutely. And so if people want to find out more about you, about the work that you do, how can they do that?
So we have an Emily Program website, emilyprogram.com, and on there we have blog posts about ARFID. We have information about our different locations and kind of just, again, just to kind of bring awareness to eating disorders as well.
Fantastic. And then one other thing. What does treatment really look like for those suffering with ARFID and OCD and anxiety? More specifically, and what would they expect if they were going to be treated for that?
Yeah, so at least for us, really what treatment is going to look is again developing those skills to address the anxiety. So that may be cognitive behavioral therapy, where they're developing skills, challenging some of those anxious thoughts, dialectical behavioral therapy, learning some coping skills around like emotion regulation or distress tolerance to help kind of create that base for them to have that kind of toolbox to be able to use when they feel anxious. And then again, depending on which kind of subtype, it might be doing something like food exposures. I really, really highlight, especially with parents, because oftentimes with those sensory sensitivities, they may have tried food exposures at home and
Yeah.
for whatever reason may not have gone well. And so really what we're trying to do, at least here, is to really kind of change that and to make food exposures fun.
Yeah.
We intentionally don't call them food exposures, we call it food discovery. And really it's just kind of time to explore. Sometimes we're looking up food or
Yeah.
listening to food songs and just trying to
Yeah.
make it
It's
fun and
important to
take
make
that.
it a bit more fun sometimes, or a bit more interesting,
Exactly.
rather than
And take
just
that
exposure.
pressure.
Yeah.
Yeah, take that pressure away. And I think especially
Yeah.
for parents, there's that anxiety that like, oh my gosh, my kid isn't eating. And so
Mm.
I understand the pressure that may have happened, but really again, trying to make it fun. And same thing with those fear aversive consequences. We may be doing that fear hierarchy and gradually challenging that fear, but again, trying to make it more in not in it's not always enjoyable to be in treatment, but to kind of like take that pressure away. And if we're asking our kids or adults to do an exposure, then we're going to be doing it alongside them to really kind of challenge that anxiety and really
Mm.
trying to build that confidence.
Yeah, absolutely. So that it feels a bit more like a team thing, and maybe it isn't just the individual feeling that they have to do everything all on their own.
Exactly. And it kind of takes away that like, oh, like I'm like in a fishbowl, everyone's looking at me while I'm doing this. But really, yeah, exactly like you said, like we're a team and we're doing this together.
Mm. Okay. And is there anything else important about ARFID that you would like to mention that for the people who are listening?
I think that really highlights a lot. I think again, I'm in no way trying to villainize the medical community, but I think understanding that they are experts in a lot and like they don't get training and everything. And so if you have a concern, like using your voice and sharing that and saying like, I really think this might be more than just picky eating or more than just XYZ.
Mm.
And really
Yeah.
kind of digging into it, I think is something I really want to highlight for parents.
Yeah. Fantastic. Well, all of your information will be in the show notes. If people want to find that, they can. And yeah, Taylor Rae, thank you so much for coming on. It's been great talking to you.
Absolutely. Thank you so much.
This video is for educational purposes only and is not a substitute for professional mental health advice, diagnosis, or treatment. If you are dealing with OCD, anxiety, or any mental health concerns, please consult a licensed mental health professional for support.